Type 1 diabetes is an autoimmune disease characterized by the destruction of insulin-producing beta cells in the pancreas, leading to chronic hyperglycemia. Conventional treatments focus on managing blood sugar levels, but they do not address the underlying cause of the disease. Stem cell therapy has emerged as a potential curative approach for type 1 diabetes. Case report: in a groundbreaking medical achievement, a Chinese woman with long-standing type 1 diabetes has experienced a complete reversal of her condition following a stem cell transplant. The patient, identified as Ms. Liu, had been diagnosed with type 1 diabetes for over a decade and had been dependent on insulin injections to manage her blood sugar levels. Procedure: Ms. Liu underwent a stem cell transplant at the Tianjin First Central Hospital in China. The procedure involved harvesting stem cells from her bone marrow and then infusing them back into her bloodstream. The transplanted stem cells were expected to travel to the pancreas and differentiate into new insulin-producing beta cells. Outcome: following the transplant, Ms. Liu's blood sugar levels gradually returned to normal, and she was able to discontinue insulin injections within a few months. Over 2 years after the procedure, Ms. Liu remains free from diabetes and has not experienced any adverse effects from the transplant. Significance: Ms. Liu's case represents the first documented instance of type 1 diabetes being reversed through stem cell transplantation. This breakthrough has significant implications for the treatment of type 1 diabetes and offers hope for a potential cure in the future. How stem cells reverse type 1 diabetes. Stem cells have the remarkable ability to differentiate into various cell types, including insulin-producing beta cells. In the case of type 1 diabetes, the transplanted stem cells are thought to have migrated to the pancreas and replaced the damaged beta cells. This restoration of beta cell function enables the body to produce insulin naturally, thereby reversing the disease. Future prospects: while Ms. Liu's case is a remarkable success, further research is needed to validate the efficacy and safety of stem cell therapy for type 1 diabetes. Large-scale clinical trials are underway to evaluate the long-term outcomes and potential risks associated with this approach. Conclusion: the successful reversal of type 1 diabetes in Ms. Liu using stem cell transplantation marks a significant milestone in the field of regenerative medicine. This breakthrough provides hope for a potential cure for this debilitating disease and opens up new avenues for research and treatment development. Additional information: type 1 diabetes, an autoimmune condition where the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. Stem cell transplant, a procedure involving the harvesting and infusion of stem cells into a patient's body to repair or replace damaged tissues or organs. Beta cells, specialized cells in the pancreas that produce and secrete insulin, a hormone that regulates blood sugar levels. Insulin injections, a common treatment for type 1 diabetes, where patients inject insulin to manage their blood sugar levels.